My name's Dr. John Green. I'm a GP and I've been working in this practice in the Tyne Valley at Prudhoe Medical Group for about 15 years. We have young people who are going to casualty on a Friday night because of their alcohol drinking, maybe experiencing injury from being drunk or intoxication, and we have parents who are coming to talk to us about these things and ask for our help. I think society, we're quite used to understanding the longer term risks of alcohol in terms of high blood pressure, risk of heart disease and stroke, and increasing risk of cancers and liver disease and that sort of thing. But increasingly we're aware of the risk of the brain development and function, which particularly affects young people. The advice is quite clear now that the healthiest and best option is to have an alcohol-free childhood, to give those important years of 15, 16, 17 where the child's brain and body is developing most quickly, the best chance to do that with low risk. And we're increasingly aware that if alcohol is used in those times, then we run the risk of interfering with that development. So problems with brain function, such as motivation, difficulties with reasoning, difficulties developing interpersonal relationships, and those are the sorts of problems that a young person can carry on into their adult life. So having an alcohol-free childhood up to the age of 18 ideally is the best way to protect ourselves from that. The effects of alcohol on our mental well-being are well recognised now, and we see that quite a bit in general practice, both in adults but also sadly in young people as well. A lot of young people feel it makes them relaxed, that it makes them happy, but in fact the truth is, and we see this every day in the surgery, that alcohol use is related to low mood and anxiety and poor self-esteem, as well as risky behaviour and developmental problems. I think it's really hard for parents. You know, there's a lot of pressure when our young people are growing up and doing what teenagers do in terms of testing boundaries, and I think parents struggle to know quite how to manage it. And I think the great thing about this campaign is it's going to empower parents with some extra knowledge and just some confidence to have those conversations, that you know it does have an effect on our young people, but if our young people are going to drink, certainly not before 15. You know, I think parents can be reassured that that's firm advice, and if their children are going to drink, because you know every circumstance is different and every family is different, but that's better done in a supervised way. So and that's helpful for parents when their young children are asking and maybe requesting alcohol for parties. You know, ideally they would say no, you know, wait, but if they are going to have a drink, the risks are much reduced if a parent is around. The parents often ask, you know, how can I have these sorts of discussions with my teenager? And that's why this guidance is so helpful, because we're now on a firm footing with evidence about risk to be able to say to parents, it's not typical that children drink from 11, 12, 13, 14. You know, most children are not drinking at that age, and so it's okay to say no. And we know that young people do listen to their parents, even though sometimes they pretend they don't.